Hi there. So moving on to fibromyalgia. Fibromyalgia is characterized by pain in the soft tissues and stiffness inside the muscles, tendons, and soft tissues. There's no obvious inflammation or atrophy. There can be sleep disturbance and severe fatigue, and anxiety and depression and/or depression may be present. The cause is not known, but they believe that it may be an imbalance between serotonin and other transmitters, and it could be due to an increased production of the substance P. So fibromyalgia has many predisposing and aggravating factors, including a higher incidence in women aged 20 to 50, a history of physical and psychological trauma and chronic pain, sleep deprivation, and stress and fatigue. Is diagnosed primarily as a checklist disorder where you try to exclude other disorders first before you make a diagnosis of fibromyalgia. The treatment includes avoidance of stress and stress reduction, regular exercise in the morning, paced activity and rest is needed, applications of heat and massage, analgesic drugs, which are painkillers, low doses of antidepressants, NSAIDs, and then new drugs like Lyrica have been shown to be effective. Joint disorders, we have osteoarthritis. This is a degenerative disorder of wear and tear of the joints, and it may often be a result of increased weight bearing or lifting, especially with obesity. And its incidence is increasing. There has been a genetic component that has been identified with mice. The pathophysiology is the articular cartilage is damaged, and then the surface of the cartilage becomes rough and warm. That damage releases enzymes and further accelerates the damage or disintegration. Eventually, the subchondral bone may be exposed, and the destruction to the bone can cause cysts or bone spurs, osteophytes, and cartilage to break off. The joint space becomes narrower, and then there's going to be secondary inflammation surrounding the tissue in the joint, which can lead to a loss of motion, range of motion, and pain during weight-bearing use. It's usually found in large joints like the knee. So you can see here the articular cartilage is damaged, is gone, worn away, and it's eroding into the bone, and you can see some cartilage fragments, and there may be bone fragments, and it can form cysts inside of the bone. The primary form is weight bearing and obesity and aging. The secondary form means that it can be caused by other things such as trauma or repetitive use. Genetic factors do play a role. Weight-bearing joints most frequently affected, but sometimes you can see it in the finger joints. Signs and symptoms: aching pain with weight-bearing or movement. Joint movement is limited. Recreational social activities become limited. Walking becomes difficult. There's a predisposition to falls. And temporomandibular joint syndrome, TMJ, mastication, chewing, and speaking are difficult. And then when it's in the hands, you may see enlargement of the distal interphalangeal joints. Treatment includes using adaptive devices that minimize stress, like a cane, pacing activity, mild exercise programs to maintain fitness and joint function, supports such as braces, and orthotic inserts in shoes. Including continuing treatment, massage therapy can help the surrounding muscles and relieve the joint, physiotherapy, acupuncture, occupational therapy, glucosamine contrite supplements that may increase improve the health of the joints, injection of synthetic synovial fluid, NSAIDs, analgesics, pain medication, arthrotomy to stabilize the joint, and surgical joint replacement, where they actually you get your knee replaced or your hip replaced. And the next type of arthritis of the joints, inflammation of the joints, is rheumatoid arthritis. This is an autoimmune disorder and causes chronic systemic inflammatory disease. There is a higher incidence in women than men, but it can affect all ages. The pathophysiology is the synovial capsule gets inflamed, and there's cell proliferation. There's a pannus form where there is a granulation, a breakdown of the tissue that's spreading. Then the cartilage can erode, creating unstable joints. Then fibrosis, which is where it calcifies and obliterates the joint space, and then it reduces the movement. And ankylosis is where the joint is actually fixed in place and deformity develops. Other changes that frequently occur include the atrophy of the nearby muscles, bone alignment shifts. Muscle spasms can be caused by the inflammation and pain, and then contractures and deformity may develop. And so what you can see is there's the inflammation of the synovial membrane, a pannus forms, the cartilage begins to be lost, and then we got scar tissue forming, and it's filling in, and then eventually ankylosis is where it stops the movement. This is where the joints deformity of the joints. This is a typical deformity in the hands of a rheumatoid arthritis patient, where the joints are no longer aligned and they have some ulnar drift. Some of the systemic effects of rheumatoid arthritis include marked fatigue, depression, malaise, anorexia, low-grade fever. Also, iron deficiency anemia that is resistant to iron therapy can be found. The cause is not exactly known. There is a genetic factor and a familial predisposition. Some of the cases have been linked to viral infections, but overall the cause is not known. Signs and symptoms: affected joints are extremely painful. There's a stiffness in the joints and a redness and swelling, heat. It's often in the small joints and often is bilateral, so that means the joints in the fingers in the right hand and the left hand. Joint movement is impaired, and eventually the joint becomes fixed and deformed. Systemic signs are fatigue, anorexia, mild fever, generalized lymphadenopathy, swelling lymph nodes, and generalized aching. Treatment: balance between rest and moderate activity, hot and cold applications, physical and occupational therapy, and NSAIDs, steroid treatments to reduce severe inflammation, analgesics for pain. There are some anti-rheumatic drugs such as gold salts, methotrexate, and hydrochloroquine, which has got a lot of, I think this is the one that's got all the information about in the press lately. Hydroxychloroquine. I don't know off the top of my head. It sounds like it. And then biological response modifying agents such as infliximab, rituximab, and anakinra. There's another form of rheumatoid arthritis called juvenile rheumatoid arthritis. There's several different types. The onset is more acute, which means it happens more rapidly, and it also can affect the large joints. Still's disease is a systemic form where there is fever, rash, lymphadenopathy, hematomegaly, which is increased size of the liver, and joint involvement is the second form of juvenile rheumatoid arthritis, calling polyarticular inflammation, so multiple articular inflammation. The third form is where it involves 4 or fewer joints, but causes uveitis, which is the inflammation of the eye, the iris, the ciliary body, and the choroid layer of the eye. Infectious arthritis is also known as septic arthritis. This is where there's an infection of the joint, and the joint becomes red, pain, and swollen with decreased movement. Often it's because due to trauma into the joint or through a non-sterile injection or surgery, and it's secondary, or it can be a secondary infection from bacteremia, which is bacteria in the blood. Treatment with antimicrobials over a sustained period of time often requires IV, and it might be from a surgery or something like that where you increase the chance of getting that joint infected. Gout, also known as gouty arthritis, is where there is a deposition of uric acid, which is the byproduct of nucleic acid metabolism. And that uric acid deposits in crystals forming the joint, which causes inflammation. And then the formation of a tophus, which is a large nodule of urate crystals. That tophus causes local inflammation and occurs after the first attack of gout. And it's just that buildup of that uric acid in the joints that crystallize off, almost like, you make rock candy, you put a lot of sugar in there, and then it becomes a crystal. The same thing with uric acid in your synovial joints. And here you can see some urate crystals. And they're going to damage that synovial membrane and cause inflammation and pain. And some of the things that can cause uric acid accumulation crystals are inadequate renal excretion, which is the kidneys not getting rid of the uric acid, chemotherapy, metabolic abnormality, and genetic factors. So inflammation causes redness, swelling, and pain. Treatment is treated by reducing uric acid levels with drugs and diets. This is the disease of kings back in the day, because they were the only ones that could eat enough meat to actually have the dietary problems and the increased uric acid in their blood. The use of NSAIDs to blood tests will cause a false negative. So if you there are looking and thinking that maybe it's gout, but you took some kind of NSAID, it will give a false negative. The next disorder is Ankylosing Spondylitis. This is a chronic progressive inflammatory disorder. It affects certain joints, including the sacroiliac joint in between the hip bone and the sacrum, the intervertebral spaces, and the costovertebral joints, the joints between the costal cartilage and the vertebrae. It's more common in men between ages 20 and 40, and the cause has not been determined, but it could be thought as an autoimmune disorder. There is a progression to the condition with the vertebral joints become inflamed, and then the joints actually fuse together, causing a loss of mobility. As the inflammation goes up the lower back, up into the spine, kyphosis develops, so it spreads out. And osteoporosis, which is going to decrease the bone density, is also going to be common. Eventually, it can lead to a condition where you can't expand your lungs quite as well. The signs include lower back pain, morning stiffness, pain when lying down, and the spine becomes rigid. Systemic effects include fatigue, fever, weight loss, uveitis. It can be treated by drugs to relieve the pain. Exercise therapy, physiotherapy, and occupational therapy. There's no real treatment to it. It's just going to be treating the symptoms. And you can see how his joints have fused together. Okay. Other inflammatory joint disorders, bursitis, is the inflammation of the bursae associated with the bones, muscles, and tendons. Most common causes are repetitive motion. Diagnosis can be through a physical examination or ultrasound or MRI. Treatment includes rest and anti-inflammatories. Synovitis, inflammation of the synovial membrane. The movement is restrictive and painful. Diagnosis is when the joint is swollen, red, and warm. You can also analyze synovial fluid to see if there's any bacteria growing and there's infection. Treatment is anti-inflammatories, and again, looking for the underlying cause. Tendinitis, irritation of the tendon. Dull and aching, mildly swelling. The cause can be from single trauma or rotator notion. Diagnosis made by the physician. Rest, cold, pain relievers, physical therapy.